pasyente pamilya sa kanya'y mahalaga. Kaya bawat check-up, laging may pag-asa. Si Doc Chris Lasco BMD, para sa pamilya laging ready. Kung kailangan mo ng konsulta dito, pumunta sa klinika, yun ang totoo.
Yan. Okay, narinig ba ako? Mainit. Good day, Dr. Chris Lasco BMD, and welcome to another video. And welcome to the Off-Duty Family Doctors Podcast. Topic ko for today is, well, contact dermatitis. Pagpasensya na yung boses ko, medyo hoarse. May sakit ata ako ngayon. Kahapon pa. Anyway, this is a pre-recorded video kasi baka hindi ako makapag-live stream today. And ang pili kong topic for today would be contact dermatitis. Isa sa mga topics na pinag-aaralan namin ngayon and part of my diplomate examination. So, hindi lang siya for dermatology. Family doctors can also manage contact dermatitis basta't hindi siya complicated at hindi siya nagkakaroon ng mix up with other comorbidities. So, ano ba ang contact dermatitis? Minsan kasi iniisip lang nila is allergy lang ito. Minsan is kati-kati, no? Nagkakaroon ka ng rashes sa kamay, sa isang bahagi ng iyong katawan. Pero mas malalim kasi ang explanation ng contact dermatitis. So, kunin natin itong reference natin dito sa Philippine Dermatological Society, sa website nila. Okay? So, this is sa website on contact dermatitis. Okay. So, this is authored by Dr. Encarnacion, Villaroman, and Dr. C. Okay? So, contact dermatitis is a skin inflammation or eczema that is triggered by a substance that come in contact with the skin. So, judging with the first line of the definition is there is contact. That should be the first qualifier. Na nagkaroon ka ng exposure by means of direct contact to your skin. Okay, kung wala yun, it defeats the purpose of defining it as contact dermatitis, diba? So these substances can either be chemical, biological, or physical agents. So ano ba ang mga common na kakaroon ng contact sa inyong skin? It either be makeup, lotion, soap, okay, your clothes, okay, yung everyday na pamper ng mga kababaihan, sa mga kalalakihan, ano pa ba? Anong ginagamit natin? Pwedeng sombrero, pwede rin namang mga gamit na sinusuot natin, relo, singsing, okay, kwintas, di ba? That can also be a source of, well, contact dermatitis. Lalo na kung meron kang trigger na nandun sa component nung gamit na yan. Okay? So, if you have triggers about that, you are triggered by the components of that material. So, contact dermatitis, after a single or multiple exposure, may be irritant or allergic. So, we have two types, irritant and allergic contact dermatitis. So, irritant contact dermatitis is different from allergic contact dermatitis because of the manner of exposure and the type of reaction. So, dito sa website naman nila, they define irritant contact dermatitis so as is a non-specific, non-allergic response to the skin directly due to chemical damage. So, direct contact after the exposure, nagkakaroon ka ng reaction. Okay? So, there is no lag time. Immediately, magkakaroon ka ng reaction sa inyong balat because of the exposure. Okay? While as yung, this is an example. Let's say it's a dishwasher. So, this is a photo from the website. So, nagkakaroon ka ng immediate flare-up dun sa inyong balat. And if you notice here, there is exfoliation. Exfoliation meaning natanggal na yung parte ng skin. Okay, there is also erythema and also hyperemia sa mga areas ng balat. Okay, so this is a example wherein there is an employee that used a dishwasher in his or her occupation and came in contact with soap and water. So, in that situation, nagkaroon na siya ng reaction dun sa sabon. Paano natin ma-avoid dito? Siyempre, avoid getting in contact with the soap na nagkaroon ng trigger. So you could either use gloves, diba? Now, how about allergic contact dermatitis? So ito. So allergic contact dermatitis is a slow, with the emphasis of S-L-O-W. No? Lakihan na natin. Ayan. Ay, nakita na yung picture. Yan, slow. Sabi niya, slow. Okay? Slow, delayed response. Sorry, medyo maingay sa labas. Okay. Reaction to the skin or to an allergen. So, contact allergens are either be hair dye. Okay, pwede yun. Yung nagpapakulay ng buhok. Jewelry, rubber, topical medications, skincare products like yung mga makeup, plants, chemicals, and many more. The skin may develop allergy to these environmental substances and it's not immediate. So, hindi siya agad-agad magkakaroon ng reaction. So, kung yung reaction occurred immediately, within siguro 30 minutes or minutes from the exposure to the agent, that is irritant. Now, if there is a previous exposure and then the next exposure nagkaroon ng reaction that is like delayed type, that is your allergic contact dermatitis. This example here is this one. If you notice this picture, but kaya? Ano kaya yung exposure niya? This one. This. The belt buckle. The belt buckle is usually the main component that I might hint or I might take into consideration, nagkaroon siya ng reaction sa kanilang balat is nickel. Okay, the most common metal that can cause allergic contact dermatitis, which is nickel. Ayan. So, common, frequent exposure to the buckle led to this allergic response dito sa belly. Below the belly button. Sorry. Below the belly button. Yan. Okay. So, another yan, ito. This is from the American Academy of Family Physicians. So, how would you differentiate the features of the two contact dermatitis? Okay. Irritant location is usually more common on the hands. Okay. Allergic is usually exposed areas of the skin, often also with the hands. Now, the first example, pag napansin sa irritant contact, is more on the hands kasi sila yung they work grimy, ginagalaw eh. Diba? Pag trabaho ka, the occupation is there. The exposure is there. For allergic contact dermatitis, the exposed area, like dun sa belly button or below the belly button, okay, or the hypogastric area, that's the quadrant or the area of the abdomen, na exposed dun sa belt, yun yung nagkakaroon ng reaction. Okay? And then for the symptoms, take note guys, it's burning in quality and itchy or pruritus with pain. Burning in quality and pruritic and painful. Whereas in allergic contact dermatitis, it's predominantly itchy. Makati. Okay? Because it's more on the release of histamine response. Allergic response. Okay? Then the lesion borders are less distinct in irritant contact dermatitis, wherein in allergic contact dermatitis, there is a distinct angle, lines, and borders. So if you go back to the picture, this one, you would note that there is an area of demarcation kung saan lang siya nagkakaroon ng reaction. Hindi siya kalat. Okay, hindi siya kalat for allergic. For irritant, you might say that it might just be here, but take note that the extent of the symptoms extended up to the tenors, meaning dito sa palad ng pasyente. Okay? Ill-defined ng borders. And it might progress, no? Lalo na kung sobrang lala nung exposure mo dun sa chemical. Okay? That depends on the length also of the chemical exposure. Kung dishwasher yan, at nagdi-dishwash sa isang fast food chain within the entire shift, baka bawal pa sa braso, diba? Yun naman ayaw natin mangyari. Okay? So there is less distinct borders in irritant contact dermatitis. There is more distinct angles, lines, and borders in allergic contact dermatitis. Okay. Now, paano ba ang gamutan? At paano ba natin na-diagnose yan? So we go to the Department of Health. Okay. Actually, ngayon, ito yung mga guidelines na to, these are very helpful for us doctors to manage or help us manage cases of this situation. Hindi lang siya sa mga karamdaman na sa high blood, diabetes, syempre. Yung balat is also a important area of concern because it's the largest organ in the body, and we have to know also how to manage these large organs in our body. Okay, so the Philippine Clinical Practice Guidelines on Contact Dermatitis was created last 2023. So under the campaign of the Jose Reyes Memorial Medical Center and UPPGH, National Institute of Health, and Institute of Epidemiology. So the guidelines state here. So this is one. This is available for all doctors and even in the public. Lalo na kung alam nyo kung saan nyo maghanap. Pero syempre, this is more in line with the doctor's practice sa amin. So this was published August 2023. So this is a guideline for contact dermatitis. Now, sa amin, to make it more easier for us to know ano bang kailangan natin gawin, well, first we have to read about the book or the guideline. Pero there's a summary about this. Ang importante lang natin matouch would be how is it diagnosed? What's the management? Kasi maraming maling paniniwala about sa paggagamot ng allergies or contact dermatitis, diba? So, based here on the executive summary or summary of recommendations. So, in diagnosing contact dermatitis, lalo na allergic type, we know the clinical pattern of it has a slow development, delayed hypersensitivity reaction, and there is a previous exposure. Usually metals, cosmetics, products that you apply in your skin, diba? But to know exactly anong type, anong cause yun, anong component, we have to do a patch test. Okay, patch testing, sabi niya dito, is used to diagnose allergic contact dermatitis. So patch testing is you apply a series of tests in your back. Tingnan natin makahanap tayo. Patch test. Patch test. Yeah. Image. Yeah. This is a patch test. Yeah. So patch testing is used to diagnose contact dermatitis. Allergic type contact dermatitis. Kasi each patch is corresponding a allergen. It either be heavy metals, dust mites, nickel, cockroach, ganun, insekto, ganun. Pwede silang magkaroon ng reaction. Kung mamumula at magkakaroon ka ng positive reaction like here, yan. 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 That means that's your allergen. You're allergic to the following components. That's your patch test. Okay? Another image, ito. Yan. Yan. Meron ka reaction doon. Meaning, positive yun. The rest are negative. Diba? So, that is your patch test. Now, what else? Okay, another way of diagnosing allergic contact dermatitis is your ROAT or repeat open application test. That's the simplest term of just apply it in a small area of your skin from a repeated time. Then check if there's any reaction. Kung magkaroon ka ng reaction, well, wala. That's your allergen. Okay? And you have to avoid that. You have to avoid the allergen, guys. Kung alam nyo na kung ano yung nagkakaroon ka ng allergies kayo, avoid it. Ito na lo, please lang. Para hindi na kayo pabalik-balik sa emergency room. If you're allergic to shellfish, to seafood, okay, to milk, to eggs, iwasan nyo na. Okay? Iwasan nyo na. As much as possible. Huwag nyo babalaking magkaroon ng exposure. No? So the third recommendation, among patients suspected allergic contact dermatitis, we recommend against the use of home remedies. Guys, this is the most over mali na ginagawa ng ating mga pasyente. Sabi niya dyan, against the use of home remedies. What are those home remedies? Lagyan ng suka, lagyan ng toothpaste, ano ba? Okay guys, meron pa yung meron yung remedy na paihian mo. Okay, no. It will just make it more irritated, erythematous, and inflare. Okay? It might even make it worse. Okay? It might cause damage to your skin. Guys, wag. Okay? Better, if you don't know what to do, seek consult. Okay? Seek consult to your doctor. Madali lang naman. You take an online consult, take a picture, send it to your doctor. Get an online prescription. Or if not, if kaya mo pumunta sa clinics, go to your primary care doctor. Okay? Kasi syempre, universal healthcare na tayo. Go to your primary healthcare doctor and let the doctor see your lesions. Okay? Ano pa? Among patients with contact dermatitis, we recommend the provision of patient education. That's why you're here, guys. This is patient education in progress. Ito ginagawa natin. Habang nag-uusap tayo, you have to avoid your allergens. You have to avoid home remedies that are being used left and right. Okay? Sabi ni nanay, sabi ni tatay, okay, wag. Patihin muna kayo sa doktor, mas maganda. Para hindi magkaroon ng peklat yung balat nyong makutis. Diba? Mamaya, you will regret the things that you've done. Mamaya, naglagay ka dyan ng suka. Ganun. It will just either aggravate it or it will not work at all. Okay? Ano pa yung suggestion nila? We recommend the use of emollients, barrier cream, as an adjunct to topical corticosteroids. Nandiyan na tayo sa gamutang part. Okay? So, emollients are moisturizers. Okay? To avoid breakage of the skin. Kasi nagkakaroon na ng inflammation that is prone to disruption of the barrier, the physical barrier of your skin. What your barrier cream does is it adds an extra layer of protection para hindi pumasok yung bacteria and at the same time para hindi mawala yung moisture ng yung balat. Okay? If it's more inflamed, the tendency there is it will be warm, it will be dissipating more moisture, and it will be more accessible for bacteria to colonize. Okay? Magkakaroon ka ng secondary bacterial infection. Yun ang ayaw naman natin. Now, topical corticosteroids or steroid cream, they can reduce the inflammation. But take note, guys, that there are strengths in topical steroids. Kailangan yung mga steroids na to are prescribed by your doctor. Okay? Huwag basta-basta bumibili ng ganyan kasi it might either also be too tough, too strong to your skin, or too low na walang effect at all. Sayang pera. Okay? Para hindi kayo maksaya ng pera, magpatingin sa inyong doktor. Liwanag yun, guys, ha? Okay, another recommendation is, well, topical calcineurin inhibitors. Medyo, hindi naman kayo makakuha dito without a prescription, pero as much as possible, magpatingin na lang kayo sa doktor. Okay, guys? Okay? And then, ang pinaka-gist na makukuha siya na dito is patient education. Seek consult, avoid remedies, okay? And understand what might be your initial exposure para masabi nyo sa doktor agad. Naintindihan? Okay. So, next recommendation, patients with contact dermatitis, you should have, who have frequent eruptions to coexisting atopic dermatitis and who have severities and baseline should be referred to higher care. Now, who are these higher care? Syempre, our friendly dermatologists. Okay? Dermatologists are the more specialized patients, are doctors, no, for your skin care. Now, it's not the reason why we as family doctors are taking patients from dermatologists. No, it's just the essence of, well, primary care. If this condition can be managed, okay, by a primary care physician, better because costly, it will be more less of a price kasi it will just go about with a lot of treatment. Okay, we correct also your misperceptions, maling paniniwala about yung sakit nyo. And it's the same. We're also your primary doctor. If you have a more serious concern about the dermatitis, well, we can refer you directly to a specialist if the condition will work. If the condition is not improving, okay, during the first consult. And that is the trend right now. As a primary doctor, you should also treat your patients initially, and then if it warrants specialty referral, i-refer namin kayo sa specialista kung hindi talaga kayang gamutin ito in a primary care setting. Okay? Among patients with chronic calcitriant contact dermatitis, medyo malalalim na to, they suggest phototherapy. So phototherapy usually are treatments provided by your dermatologist. And syempre, that will just be reserved for severe cases. And hindi na aabot na sa amin as primary care doctors. So ang goal namin is wag umabot sa ganyan kasi mahal yan. Lalo na if it's coming from a private practice, syempre, maganda sana kung meron tayo sa government and it will be covered by PhilHealth, better, no? Pero as of now, syempre, higher level of care will be reserved to severe diseases. Kung mild naman siya, consult to a primary care physician muna. Okay? So, hanggang doon lang naman. I think phototherapy, yun ang sabi niya dito, JAK2, these are immunosuppressives naman na. And they require management with primary specialist. Biglang umulan ngayon. Okay? So, I suggest, if you have conditions like contact dermatitis, you should always familiarize yourselves with the components kung ano yung pinapahin nyo sa inyong balat. Kasi mahalaga na maging aware kayo kung ano yung bago nyong in-apply or dati nyo nang ina-apply or may something wrong with the things that you are applying to your skin. Aside from that, if you're new to your job, it's important for you to be safe, no? If kailangan mag-gloves, wear gloves, wear protective equipment para magkaroon kayo ng protection from any chemicals na ayaw nyong magkaroon ng contact sa inyong balat. Okay? So, I think hanggang doon lang yung matatouch natin ang contact dermatitis. And thank you guys for watching. And hopefully may mga nakuha kayong topics or importanteng details sa video na to. It started to rain. I'm still sick. Sorry. And hopefully by tomorrow wala na ito. And please continue also to support the channel, support content creators, especially professionals who want to provide patient education or meaningful educational tips sa inyo, okay, in the easiest way possible by means of social media engagement, no? Also, please pray to Doc Willie Ong for a speedy recovery. Okay, Doc, kaya mo yan. Okay, and you have already inspired a lot of doctors to provide patient education, accessibility to the means of social media. Thank you, Doc, and hopefully we'll get through this, no? You are stronger. We are stronger. Okay, this is Doc Chris again, Scrubby MD, your family doctor, and see you on the next video. Bye-bye, guys. Where is my outro?